हाय एवरीवन, मेरा नाम अश्मिता है और आज की इस वीडियो में हम नर्सिंग के कुछ क्वेश्चंस सॉल्व कर रहे हैं। तो चलिए फोकस करते हैं। Which would be the priority intervention for a child suspected of varicella, that is chickenpox? तो पहला जो चीज़ है वो है contact precautions. Primary source of transmission is secretions from the respiratory tract or droplet of infected persons, like through airborne. And transmission occurs by direct contact, skin lesions to a lesser extent, and also through contaminated objects. तो like priority ज़्यादातर क्या होगा? Anyway, वो हमें इन चारों ऑप्शन से सिलेक्ट करने हैं. नेक्स्ट, कॉन्टैक्ट एंड ड्रॉपलेट रेस्पिरेटरी प्रिकॉशंस. वैरिसिला या फिर चिकन पॉक्स जो है ना, इट्स अ हाईली कंटेजियस थिंग. सो कॉन्टैक्ट एंड ड्रॉपलेट रेस्पिरेटरी precautions should be started immediately because the primary source of transmission is secretion of the respiratory tract or droplet, and also by contaminated objects. So according to me, second would be the best one. Third, droplet respiratory precautions. Now, droplet precaution is very important because that is the primary source of transmission. Transmission also occurs by direct contact and contaminated objects, but we have got the best option till now. Next, universal precautions and standard precautions. Now, standard precautions, formally we call that the universal precautions, should also be maintained, of course. The term refers to protecting oneself from patient's blood or bodily fluid or anything. Okay. Next question. Which would be the priority intervention? Means out of these four, we have to choose the most appropriate priority for a child diagnosed with chickenpox or varicella who was prescribed diphenhydramine, that is Benadryl, for itching. Now, giving a hint over here, the test taker over here should understand that the primary source of transmission of varicella or chickenpox is secretions of the respiratory tract of the infected persons, that is airborne, and transmission occurs by direct contact, skin lesions to a lesser extent, and contaminated objects also. So based on that information, let's go through the 4 points. Give a warm bath with mild soap before lotion application. Avoid Caladryl lotion while taking a diphenhydramine, that is Benadryl. Apply Caladryl lotion generously to decrease the itching. Give a cool shower with mild soap to decrease itching. Taking the very first point, give a warm bath with a mild soap before lotion application. To help decrease itching, a cool bath is a better option. Soap and warm water can cause more itching. Okay, so no. Second one, avoid Caladryl lotion while taking diphenhydramine, that is Benadryl. Now, Caladryl lotion contains diphenhydramine, that is Benadryl, and the child would be at risk for toxicity if the Caladryl is applied to open lesions. So yes, this is the first priority intervention that should be done. Next, apply Caladryl lotion generously to decrease itching. Caladryl lotion is applied in an amount to cover the lesions. Okay, so ये नहीं जाएगा. Give a cool shower with mild soap to decrease the itching. Cool shower can be soothing and decrease itching. Mild soap is drying to the lesions and can cause more itching. Okay, तो contradictory point है. एक जा रहा है एक नहीं. Okay, next question. Which signs and symptoms would the nurse expect to assess in a child with rheumatic fever? Let's go through the options. Ankle and knee joint pain, negative group A beta streptococcal culture, large red bull's eyes, appearing rash, stiff neck with photophobia. Taking the very first option, that is ankle and knee joint pain. Now, joint pain or arthritis is the most common symptom of acute rheumatic fever. That is about 60 to 80% of the first attacks. So, the joint pain usually occurs in two or more large joints like ankle, knee, wrist, elbow. Okay, so yes, we can go with the first point. Second, negative group A beta streptococcal culture. Now, rheumatic fever usually follows group A streptococcal infection and the culture is usually positive. Okay, तो पॉजिटिव है, यहाँ पे नेगेटिव दिया गया है इसलिए हमने ओमिट कर दी. Large, large red large red bull's eye appearing rash. The large red bull's eyes lesions are more characteristic of Lyme disease. Okay, LYME, Lyme disease. तो ये जो rash है, this is associated with rheumatic fever and is erythematous with a demarcated border. Okay, so ये भी नहीं जाएगा. Next है stiff neck with photophobia. Stiff neck with photophobia is more indicative of meningitis. तो ये भी नहीं जाएगा. Next question. The parents of a 12-year-old with HIV are concerned about his receiving routine immunizations. What will the nurse tell them about immunizations? Let's read. You are concerned about your child receiving immunizations. Let me explain why your child will not receive routine immunizations today. Now, first point के लिए, the nurse acknowledges a client's fear and then discusses the concerns to clarify any misconceptions. Immunizations and influenza vaccine are recommended to prevent infection. Immunocompromised HIV infected children should not receive the varicella and MMR live vaccines. Okay, so yes, this will go. Next, your child will receive the recommended vaccines today. Recommended immunizations जो है for a 12-month-old include varicella and MMR, that is live vaccines, which are not administered to an immunocompromised child. तो ये नहीं जाएगा. Third, your child is not severely immunocompromised, but I would still be concerned about his receiving routine immunizations. The recommended vaccines जो है that will not be administered because the child is immunocompromised. Next, your child may develop infections if he gets his routine immunizations. Your child will not be immunized today. Third point तो नहीं गया. Recommendation जो है fourth point के लिए, recommendation is for the child to receive routine immunizations unless the child is immunocompromised. Okay, तो ये नहीं जाएगा. आते हैं next question पे. After airway, breathing and circulation have been assessed and stabilized, which intervention should the nurse implement for a child diagnosed with encephalitis? So let's read the interventions. Assist with a lumbar puncture and give reassurance. Obtain a throat culture and then begin antibiotics. Perform initial and serial neurological assessments. Administer the antibiotics and antipyretics. तो first जो है, assist with a lumbar puncture and give antibiotics. तो इस point के लिए airway, breathing and circulation are part of the primary patient assessment. Neurological assessment is the next assessment to perform. So ये नहीं जा रहा है. Next, obtain a throat culture, then begin antibiotics. The child has been diagnosed with encephalitis. Unless there is a concern about the child's having strep throat, A throat culture would not be obtained, तो ये भी नहीं जाएगा. Thirdly, perform initial and serial neurological assessments. So, initial and serial neurological assessments would be a priority nursing intervention in a child with a neurological problem. So, these assessments monitor for changes in neurological status. तो ये जाएगा. Last, administer the antibiotics and antipyretics. तो encephalitis जो है ना, it's usually caused by a virus. Therefore, antibiotics are not ordered. Antipyretics may be used to help to control fevers. तो ये नहीं जाएगा. तो आज के वीडियो के लिए बस इतना ही. अगर आप किसी भी एंट्रेंस एग्जाम्स के लिए प्रिपेयर कर रहे हैं या फिर कोई भी गवर्नमेंट जॉब एग्ज़ाम्स के लिए आप प्रिपेयर कर रहे हैं, देन आप हमारे क्लासेस में ज्वाइन कर सकते हैं, भर्ती हो सकते हैं. उसके लिए आपको नीचे जो डिस्क्रिप्शन बॉक्स है वो जाके चेक करना पड़ेगा. वहाँ पे आपको सभी डिटेल्स मिल जाएगा, कॉन्टैक्ट डिटेल्स, वेबसाइट लिंक्स अबाउट आवर क्लासेस. इसके अलावा जो फैसिलिटीज़ हम प्रोवाइड करते हैं वो है लाइव लेक्चर्स, रिकॉर्डेड लेक्चर्स, पोर्टल एक्सेस, डाउट क्लियरिंग सेशंस, प्रैक्टिस पेपर्स, mock test facilities, and also study materials which would be delivered at your doorstep. तो यही था हमारे क्लासेस के बारे में. काइंडली विजिट द डिस्क्रिप्शन बॉक्स. अगर आपके मन में कोई भी क्वेरीज है देन आप कमेंट बॉक्स में कमेंट कर सकते हैं. थैंक यू फॉर बीइंग विथ मी टिल द एंड. चलिए मिलते हैं अगले वीडियो में.